So I wouldn't necessarily go right into teaching them about what to eat, because that's too high level. So I really address people where they're at and then build them up. And one of the things I found is that you have to teach them the basics of certain things, especially like one guy came in, he goes, yeah, your program's not working. I tried it for 2 weeks, it didn't work. Well, it did work, but then it stopped working. Well, what did you do? Well, I stopped the diet. I said, did you think it was going to keep working if you stopped? So you really have to educate people from the very beginning. And so there's a really important, very vital principle that I talk about, and that is about, it's not lose weight to get healthy, it's get healthy to lose the weight. And this is so basic, because looking at diabetes as a disease doesn't work as this being this cause situation. It's the effect, of course, of high insulin. If someone does not understand this concept, they're very susceptible to doing the wrong solution. Very unhealthy programs, diet, appetite suppressants, low quality products. They try to actually diet to lose weight. How many of you agree that dieting actually destroys your metabolism? You take someone who's menopause, and you ask them, how many diets have you been on? It's probably been 10 or 12, and every time they do it, of course they're doing it wrong, it slows down the metabolism. So just because someone's losing weight doesn't mean they're getting healthy. It really depends on how they're losing weight. So there's some products that people think are healthy. You have, of course, the Slim Fast, hidden sugars. If you take a look at the ingredients, high levels of soy protein isolates, which are exposed to hexane, which in PubMed is a neurotoxin, and FDA has no ceiling of how much hexane is in there. Had a lot of clients come in that have done programs like Ideal Protein, that really high in soy protein isolates, and end up with liver and gallbladder issues. So, and they're hidden sugars as well. So it's a really important question that I always ask people to figure things out, and I think it's just it's not emphasized. And that is, okay, when did this problem start? And what happened just before that? And you can get so much data. I had one lady came in with a heart attack symptoms. She's been to the hospital, spent $40,000 worth of testing, and nothing showed up. And then we find out, I said, well, when did it start? Well, 2 weeks ago. What day? Tuesday. What did you eat? She goes, oh, big banana split. I said, okay. Laid it on my table, started doing some work on her. And it was basically just a congested gallbladder, back of the liver, causing heart pain. All the heart symptoms went away. So it's really, really important to find out what occurred just before you started having that problem. I ask that question a lot. Maltodextrin, glycemic index way higher than glucose and sugar. So obesity is a symptom. It's not, if you focus on obesity, you're not going to be as successful. It's coming from too much insulin. So I have people focus on other indicators of health. I try to get them off the weight loss at first, because they may not lose weight initially, especially if they have a slow metabolism. So I always ask them, how is your energy? Is your hunger going away? That's a good indication that the insulin is coming back in a good range. Carb cravings. If you still have carb cravings, there's a problem with your blood sugars. Is your belly shrinking? There are women that are actually menopausal, that have a lot of atrophy. And it looks just like fat, identical. Because what happens after menopause is sometimes you have a spike in cortisol. Cortisol tends to turn muscle protein into glucose, and then it raises insulin. So you have this loss of muscle, looks like cellulite and fat, and they're really adamant they want to lose weight, but this takes some time to heal this process. So in the process, they're building up their proteins. It takes months and months, maybe even a year or two, to build up this protein back there, where they're per volume, the muscle is heavier than the fat. So everything is shrinking, they're not losing weight. You just have to teach them that this is normal. They have to know that, so they're not setting themselves up for a loss. So the most important thing that a person could do to increase their health is to use their own fat as fuel. So there's several advantages of doing this. Number one, now you start running on ketones. There's a lot of advantage. It's a superior fuel. More energy output, appetite suppressant, more efficient, better lipid profiles. Tumors can't consume ketones, reduced oxidative stress, and more O2, less CO2. And then you have the benefits of reduction of insulin, which is the common denominator of so many health problems. I mean, inflammatory conditions, heart, of course, diabetes, the fatty liver, high cholesterol, aneurysms, stroke, dementia. Other than that, it doesn't have any effects, but it's actually pretty connected to everything. So you get to do these two things. There's you know about the glycemic index, there's actually an insulin index too. How many of you are not familiar with the insulin index? Okay, those are, that's a scale that, it's all the non-carbohydrate triggers or the non-carbohydrate influences on insulin. And of course, fat is the lowest effect on insulin, but lean, low-fat protein, like whey protein, is very high on the scale of the insulin index. And this is why the keto works really good, because you have higher fat